Well, don't you know, she was right. Sarah Palin's death panels are back. Only the government isn't calling them death panels, more like death tests, even though the government isn't calling them that either. But trust Dr. Manny Alvarez, and again, who wouldn't, when he says that's just what's behind a government-funded effort to come up with 12 specific issues physicians should consider when figuring care for elderly patients. Bottom line, if they don't have a whole lot of years left, is it worth providing them costly medical procedures now? Doctor, if you're right, that is a death panel.
Well, you're looking at it. I'm the death panel. This is what the government wants. This is what the government wants me to do. Basically, this is a study that came out, funded by the federal government, looking at this is a survey actually that started in 1996. Looking at longevity for 4 years, risk factors of longevity. And then now it has turned into this new test to allow doctors to tell patients, look, you maybe not need, maybe you don't need that kind of screening. Maybe you don't need this kind of treatment for diabetes. You have, you're in your 80s right now. Maybe you should stop. And this is, the ethical fact that they're even proposing this is mind-blowing to me. And we wrote about it yesterday, complaining, and the response, by the way, that we got from a lot of people was amazing. This is, you don't go into healthcare, looking to decide who lives, who dies, what tests should we do.
But you do have to make decisions like that every day, right? I'm thinking if you have an elderly gentleman who's coming in for prostate cancer, you're weighing the cost of treatment on an older guy versus just doing nothing because it's a slow-moving disease.
And that is true. I mean, I don't need a crystal ball to tell me when a patient is going to die and when a patient is very sick. I don't need that. That's what I went to medical school for.
Oh, you went to medical school?
Right, yeah. Oh. This is all predicated on the fact that I'm a doctor. Right,
good.
Exactly. But the facts remain is that now everything is about dollars and cents. Even Paul Krugman said the other day that perhaps raising revenues, we should look more also at bringing back these death panels or whatever he said off the record. But nonetheless, this is something that now, we started with the U.S. Preventative Task Force telling doctors now for the last 2 or 3 years, oh, by the way, no mammography at the age of 40, do it at the age of 50. Oh, by the way, prostate cancer screening is not that good. It is not cost effective. Oh, by the way, don't do cervical pap smear. All of this is predicated on
what makes this different then, man? That they use a combination of factors?
Now this is another layer. This is another layer. So everything is coming in steps. Everybody thinks that there's going to be a big panel and the federal government is going to say, oh, by the way, give me that file of Mr. Cavuto. Oh, nothing for him. It's not going to work like that. It's going to be in layers.
And that's exactly how the White House would look at me and say, nothing for him.
Yeah, it's going to be in layers. Proposed changes in medical practices. B, put the pressure on doctors to give them guidelines to decide what works, what doesn't work, so that they can be our spokespersons to patients. And before you know it, in this whole staircase of socialized medicine that we have, you're going to have, well, you're 80 years old, you have this and that, you don't qualify for this, sorry, move on. And that into itself is the ethical dilemma that we all have. And death panel, you're looking at it. This is what they're making me do in the future, and I refuse to do it.